You can't fix a dysregulated brain if you ignore the gut. So, if you've been following and listening to me, you know that up to 90% of serotonin is made exclusively in the gut. And when the gut is out of balance, which can happen so easily, so can your child's mood, behavior, and ability to cope can be out of balance, right? So we know what emotional dysregulation is, but if you're new and you're following, it's when you literally can't calm down after a stressor of any size, particularly, large ones, but even small ones. You overreact to small challenges. You're overly emotional, defiant, or anxious. And you may even show signs of aggression, either verbally or physical, shutdown, and lots of mood swings. That's what emotional dysregulation really looks like, right? But why do parents often not think about the gut? Well, first of all, we're just starting to talk about this, even though, like, I personally have been on a probiotic since the 90s. Like, if you're studying mental health, the gut is important, right? So you're just learning about this. And, parents often get very overwhelmed when they come to me, and because there's so many paths to take. But the gut, like diet, is incredibly foundational. And of course, they're both linked, right? So why is this not happening? Why are you not learning about it? Well, one, we often think the gut is just about digestion. Really, the gut is our second brain, and the gut and the brain are connected through the vagus nerve, and there's a bidirectional um, uh, communication that goes on between them, right? So we already talked about one of our most important neurotransmitters. They're all important, but serotonin is almost exclusively created in the gut, and we need this serotonin for attention and mood. So if you have a kid who's overly emotional, we have to look at their gut, and there's lots of ways to do it. I just am working in our one-to-one brain behavior reset program with a family, and they had some outside labs done, and we were able to make a connection to their child's behavior and some of these gut, stool testing components to see what was there, what was happening. And we're going to talk about common issues, and we'll make sense of it. If you're interested in working one-to-one with me, you can go to drroseann.com/help. That's our solution matcher, and it's going to match you to the right solution. So we don't realize how important the gut is in neurotransmitters, inflammation, and the nervous system, right? And we talked about some of those behaviors besides, mood swings and irritability. It also could be related, cause difficulties with focus, as well as chronic fatigue, which is something I see an awful lot of, right? So we often think tummy troubles with the gut, right? Gas and bloating. But science says the gut and the brain are talking constantly. And when it's inflamed or leaky and it's not absorbing the right nutrients, kids can't regulate their emotions. How about adults too, right? So common gut issues that you may or may not know about. So dysbiosis, and that's the imbalance of good to bad bacteria. It's the same little kid that came to see me had largely good bacteria because they've been working with me and we've been doing things, but there still was an imbalance, and there actually wasn't enough of this one right one to help this particular behavior. I mean, this is how scientific we can get, where, so we added a strain, and we're going to see what happens is they're already seeing massive changes in the things that we're doing, right? So leaky gut, right? So some leaky gut, in that term, it may be something that you've heard people feel like is fringy, but that typically happens. There's a lot of reasons leaky gut can happen, but inflammation basically allows toxins to enter the bloodstream. And leaky gut is both ways. So it's that you are allowing things to come in, and too many of the good bacteria, and even protein goes out, right? And when I do these amazing brain maps, I can see who has a leaky gut based on what if they're getting enough protein in their brain. Pretty cool stuff. And then, of course, we go to a functional doctor and they do additional testing. Okay, food sensitivities can cause gut issues that affect behavior, right? So whether it's gluten or artificial, dyes or dairy, I have problems with every one of those. And it's okay. And I just don't have it. Thankfully, I like good stuff. Um, Constipation. So when you have a child who's constipated, but for the love of God, I don't understand how many, like, it's shocking to me how many adults and kids live with chronic constipation. Like, no way. Like, it is not normal. You need to poop every day. But toxins recirculate in the body, can cause mood issues, fogginess. I mean, it can even cause joint pains. I mean, besides that uncomfortableness of constipation. But your kid needs to poop every day. You need to poop every day, people. It's good. It's good for a lot of reasons, right? Poor diet. So ultra processed foods, high sugar, right? Foods without nutrients really can cause gut inflammation, right? It just is not good for you, right? And I know it's hard, but like you got to aim for trying to have whole foods. I mean, luckily it's gotten a lot easier to do that. I mean, there are so many ways that there's yummy whole foods out there, right? Antibiotic overuse. I remember reading a research study that said, I think it said 70% of antibiotics are not necessary. It was at least 50%. So apologies, I don't know that off the top of my head. But I mean, they want to give it out like candy sometimes. I'm in shock, right? You have a virus, an antibiotic isn't going to help you unless it has turned into an infection, like a lung infection or whatever. And even then, that's questionable. So think about saying yes to antibiotics before you accept them because they're probably not going to help you. And obviously, always work with your provider and hopefully you have a functional provider. Infections and toxins do at least temporarily impact the gut bacteria. When they're hanging around, it often is because you might have all these other things on this list. I mean, you might be checking off all these things. This is what I see when I work with people with PANS, PANDAS, and OCD, and mood issues, and autism, all my complex layered stuff, and even ADHD. This is common stuff, right? So, real life clues, there's a gut problem. The stomach aches, the constipation, the diarrhea, nausea is one, bloating, and nausea, by the way, can also just be a sign of anxiety, right? Because of our vagus nerve and how connected they are to the brain. I am not an easily stressed person, but I'm really upset. Oh, my stomach hurts. And I know, like I'm really stressed about something. I need to take care of myself. Meltdowns after eating, clue, something's going on with that food, right? Or the way your body is processing. Hangry or crashes between meals, skin issues, eczema, rashes. Eczema is like one of the biggest red flags for something is going on in the body because, our skin is our largest organ. And so we need to make sure if we're having skin issues, we're thinking about what we're putting in, what is our gut, um, doing. Constant carb sugar craving. That can be a sign of things like yeast, certainly leaky gut, different components. And then having clinical diagnoses. If you or your child has a clinical diagnosis, you need to look at the gut. And thankfully, it's much easier, and hopefully, you find a practitioner. So, what do you do if you're like, hey, Dr. Rowe, I am really thinking my kid or I myself have a gut issue that is impacting their behavior, their learning, their processing? I got you. Okay. So, number one, we're going to start with food. I mean, that's pretty logical. So, we're going to reduce sugar, gluten, dairy, and add whole foods. Don't hate my guts. This is all good stuff. Somebody messaged me and said it's not realistic to have two kids and eat healthy. I don't know where you're living. You clearly didn't have Philomena as your mother. Get it together because it's just a change, right? Okay. So, nobody said this stuff is easy, but I promise you will like the results, right? You know what I mean? We're going to add probiotics and fiber. Sometimes my restrictive eaters, we have to add actual fiber into their drinks or whatnot, but there's lots of high fiber foods. You're going to consider stool or food sensitivity testing. You got to go to a practitioner. There are things online and you can do it yourself, but you need a practitioner to interpret it, right? My family got it online. We worked together in our program. You're going to always support detoxification, hydration, movement, magnesium glycate, and 3 and 8 is what I always recommend. It's behind me. But you really want to make sure you're really, really focusing on detoxification. There's a lot of other ways to do it when you work, when you're, using any of our programs and whatnot. You can go to Solution. You can take the Solution Matcher and it will guide you to the right solution. But I have lots of information about detoxification because it's super important to get these toxins that we all are absorbing. If you're in a room with carpeting or you have plastic, you're getting toxins. It's just the way it is. And our body is inundated with these things. So we need to actively counter it. And it shouldn't be that big of a deal because there's lots of great ways to just integrate it. You always want to track behavior after meals, right? You want to create a gut brain diary. This isn't forever. You're being a parent detective. You want to start making a connection like, wow, just like Mrs. Sullivan called us in kindergarten to tell us Max was acting literally like the Tasmanian devil. And what did we do? And I was like, oh, we tried dairy again. And she was like, stop it today. She was such a great teacher. She's like what teachers should be. Loving and lots of sensory movement. And that's why she had all the Wired Uniquely kids. But always talk to an integrative practitioner. Make sure your practitioner is qualified. There's a lot of bad operators out there and false gurus. So just make sure you're going to somebody that feels like there's an alignment and it feels like what you're doing is actually working, right? But when we support the gut, our brain and behavior start to shift. I mean, this is a big deal, right? So your action step is actually to start a gut brain journal for about a week, 5 to 7 days. Track your meals, the behavior, gut symptoms, start to see there's patterns between certain things you eat. And particularly after those high inflammatory foods, sugar, dairy, gluten, processed foods with dyes and whatnot. I hope you're not all doing that. But if your kid's behavior feels, confusing, unpredictable, don't overlook the gut. People really jump to medications when what's the foundational issue? Gut is super, super foundational. It could potentially be a disruption in your child's gut could be the reason why they're dysregulating, right? And if you're wondering why can't my kid calm down? I've done this intervention, I've done that intervention. Check the gut. And if you need more support, go to drroseann.com/help. Take our 3-minute solution matcher. It's not even 3 minutes. And you're going to get a personalized plan from me, and you'll get weekly love and knowledge from Dr. Ro. You got this.
More insights and solutions, will subscribe to our Dysregulation Insider and it will show up in your inbox every week.